Thank you. Good afternoon, everyone. My name's Naren Suleiman. I'm a registrar at West Herts Hospital in the UK, and I'm going to talk about radiation exposure in video urodynamics. So we know that video urodynamics combines urodynamics with fluoroscopy to optimize diagnostic yield. We know that inevitably the patient will be exposed to radiation, and regulatory bodies for radiation protection tell us to keep this as low as reasonably achievable, but there are no specific reference levels for us to refer ourselves against. So we wanted to quantify how much we were exposing our patients to during video urodynamics and determine any significant differences between men and women, and compare radiation exposure during video urodynamics to other common urological procedures. So we interrogated our own prospective database of all urodynamic procedures performed between February 2018 and February 2019, and then cross-referenced this with the data kept by the radiology department on their fluoroscopy time and dose area product. So we had 39 patients who had video urodynamics, but after excluding those for who the data was not recorded for, we were left with a cohort of 26 females and 6 males. The mean dose area product was 4.93 gray per centimetre squared, and mean fluoroscopy time was 57.6 seconds. There was a difference between females and males, but this was not statistically significant. So we went on to compare our own data against data for urological procedures, including stent insertion, replacement, ureteroscopy, and PCNL. And this is data from a multi-centre national study done in the UK. And we found that video urodynamics is almost double the radiation of a ureteric stent insertion or replacement or a ureteroscopy. Thankfully, it's much less than that of a PCNL. So we conclude that this is a small series, and despite that it's comparable to larger series looking at the same topic. We are aware that there is considerable radiation exposure during video urodynamics, and we need to be aware of that when we're performing or referring a patient for this procedure. We can compare it in shorthand to double that of a stent or a ureteroscopy to educate ourselves and our colleagues. There was a disproportionate radiation exposure in fluoroscopy time between men and women, and perhaps this is due to screening practices, and perhaps better screening practices may reduce total radiation exposure. So I'd like to acknowledge my references and to invite any questions.
Question from the floor. I see Peter.
So indeed, you report already without frame rate reduction and things like that. So you have introduced that now.
Yes. So
yeah, that's good. But 1 minute radiation during a video urodynamics. I usually have a total radiation time of around 5 seconds and 10 seconds at maximum. I do a few snapshots.
Okay.
That's all.
Yeah. So
why do you need the other 50 seconds?
So a lot of ours are done by residents, so they're in their learning curve of performing this procedure. So there probably needs to be tighter control and better education before we're let loose with the fluoroscopy.
It's useless to see that nothing changes.
Yeah.
Hi, Helen Morton from Newcastle in the UK.
Hi.
So you compared it obviously to urological procedures. But obviously this is a diagnostic test, and maybe did you think about comparing it to other diagnostic tests such as CT-IVUs, etc., and the exposure that they would get with that?
That's a fair question. We didn't look at that, but that's definitely something to look at, seeing as it's in the same category. So yeah, thank you.
Yeah, I just want to. I think this again is an important study. I wanted to expand on Peter's question. I mean, sometimes we're looking for the point of obstruction. I mean, if you want to just define obstruction, I agree, just snapshots. But when you're looking for the point of obstruction, especially in men who have concomitant prostatic obstructions and urethral strictures, you need to step on the pedal, and you need to see more video to see where you think the obstruction is. But one one thing that for inexperienced people, especially residents, you just need to step on the pedal once and then hold it down until you hear a click. What I've seen many times, people just during voiding, they just step on the pedal and they hold it down, and then you're literally getting multiple shots. I agree. You should be able to hold it down to 20 or 30 seconds. You rarely need a minute. Well, thank you for your presentation.
Thank you.